But there are things that can be done at Dartmouth that we can't do in Boston, Massachusetts, or Baltimore, Maryland, or Rochester, Minnesota. And that is that a place like Dartmouth is uniquely situated by two incredible assets to really provide a national model for sustainable healthcare. The first is the geography and the population. Many of us around the country right now are working to try to figure out how we can provide higher quality care more efficiently at lower cost. We can do that by changing things in the hospital and changing things in outpatient centers. But what can be done at Dartmouth, where you have a population in Vermont, in New Hampshire, and even some from Western Maine, who all come to one center, is you can think much more broadly. You don't need to just think about the clinical care that you deliver, but you can start thinking more broadly about how do we engage with employer health programs? How do we engage with school systems? How do we think more broadly about health than just delivery of health care? That's an incredible opportunity, and that's an asset that Dartmouth has. The second is the incredibly powerful asset of a wonderful tradition of being the real leaders, both nationally and internationally, in healthcare delivery science. When I speak to my colleagues here around what are the important things that we all think we ought to read, what are the lessons from research that we ought to be paying attention to as we try to decide to create our own programs here and start to develop them further and evolve them, one of the first places we look is we look up north to Dartmouth. What can we learn from the folks up there who have been studying healthcare in really unique ways over the last few decades? The opportunity now is to take those two wonderful assets, that population and geography and the structure of Dartmouth-Hitchcock, and marry that with the delivery science and pull that into operations to really create what is, I think, a really exciting national model. That's an offer that you can't refuse.